William Stewart Halstead, the father of surgical education in America. William S. Halstead was born on September the 23rd, 1852, in New York City. He was the son of a wealthy textile importer. He grew up in a beautiful home on Fifth Avenue and went to private schools. At the age of 18, he entered Yale College in 1870 and was captain of the first Yale football team. After graduating from Yale, he went to Columbia University College of Physicians and Surgeons in New York. After graduating near the top of his medical school class, Halstead became a house physician at the New York hospital Bellevue. After 18 months at Bellevue, Halstead, like so many others of the day, traveled to Europe to observe and learn from famous European surgeons such as Chiari, Zucker-Kandel, Bill Roth, Bassini, and Coker. For 2 years, he studied their surgical techniques, their research, and their training programs. He returned to New York and operated at Roosevelt Hospital, the College of Physicians and Surgeons, Charity Hospital, and Bellevue Hospital. It was here he met the famed pathologist William Welch, who would become his lifelong friend. He was the only surgeon in New York at the time practicing Listerian antisepsis and Germanic aseptic technique. His fame grew as one of the best surgeons and teachers of the day. In 1884, Halstead became aware of a report extolling the anesthetic properties of cocaine when introduced onto the cornea and conjunctiva. He and a few of his colleagues began to experiment with the substance by using it on themselves, and subsequently became addicted to the drug. During a 7-month hospitalization to cure his addiction to cocaine, he was treated with and became addicted to morphine. He remained addicted to both drugs for the rest of his life. His friend William Welch, the first chair of pathology at the new Johns Hopkins Hospital, invited Halstead to join him in Baltimore and become the first professor and chief of the Department of Surgery at Johns Hopkins Hospital when it opened in May of 1889. It was here that Halstead started the first formal surgical residency training program in the United States. Trainees had to be available 24 hours a day, 7 days a week. Naturally, this meant they had to reside in the hospital and be unmarried. Only men were accepted into the residency. There was no set length of training. There was a hierarchy of junior assistant residents, and finally a single trainee referred to simply as the chief resident, second only to Halstead, who stood at the apex. As the trainees advanced, they would adopt increasing responsibility. Promotion to the next level was not assured. This became the model for surgical training programs throughout the country. His training program was meant to teach the teachers of surgery. Of his 17 residents, 11 went on to develop surgical training programs at universities throughout the United States. Halstead was known for his strict attention to hemostasis, gentle handling of the tissues, and meticulous anatomical dissection. His slow, methodological technique and obsessive record-keeping became legendary. Even today, these attributes are referred to as Halstedian technique by current professors of surgery. He was also among the first to scientifically investigate wound healing. It is said that Halstead brought laboratory science to the practice of surgery. Halstead operated barehanded like every other surgeon in the world. Halstead followed the antiseptic principles of Lister and used carbolic acid and mercuric oxide to disinfect the instruments and hands of the operating team personnel. Carolyn Hampton, his operating room nurse, developed dermatitis from the chemicals, and Halstead wrote, "As she was an unusually efficient woman, I gave the matter my consideration." In 1890, he asked the Goodyear Rubber Company to manufacture 2 pairs of thin rubber gloves with gauntlets that could withstand the carbolic acid to protect her hands. Within a few years, every member of the operating team at Johns Hopkins wore thin rubber gloves during operative procedures, and by 1911, half of all surgeons in America used rubber gloves to operate. However, widespread use of rubber gloves in the operating room did not uniformly occur until after World War I. He developed a technique to surgically treat the advanced cases of breast cancer seen routinely in his time, and the technique became widely known as the Halstead mastectomy, which was the complete removal of the breast, the pectoralis major and the pectoralis minor, and a complete axillary lymphadenectomy. This became the standard treatment for breast cancer until the late 1960s. Halstead taught the likes of famous surgeons such as Harvey Cushing, John Finney, and Joseph Bloodgood. Halstead was apparently the first to insist that the surgeon and his assistants change their street clothes before going into the operating room. He is seen here with his team seated wearing a white scrub suit. Carolyn Hampton was the niece of the famous Confederate General Wade Hampton of Charleston, South Carolina. He would later become the governor of South Carolina and then a United States Senator. Dr. Halstead married Carolyn Hampton in 1890. They had no children. The Halsteads vacationed for 4 months out of every year in their home in the mountains near Cashiers, North Carolina. After their deaths, the home and the surrounding 2,000 acres were sold and eventually became the High Hampton Inn and Country Club, which is still in operation today. His picture hangs, without fanfare, over the fireplace in the dining room. At age 70, he was operated on for gallbladder disease and postoperatively developed cholangitis from choledocholithiasis. He then developed pneumonia and died on September 7, 1922. He's buried in Greenwood Cemetery in Brooklyn, New York. His wife, Carolyn, died just 4 months later. William Stewart Halstead, the first to transfuse blood, the first in America to perform cholecystostomy, made major advances in hernia and breast cancer surgery, worked out the anatomy of the inguinal hernia repair, introduced rubber gloves into the operating room, promoted laboratory research, and organized the training of surgeons in America. He was the father of surgical education in America.